Thank you very much, everyone, and we'll continue. So the numbers went up by 1,138 in Ontario, and again, stabilizing at those levels. Pushed again, Toronto, Peel, York. Our numbers in our health unit area continue to be stable. Again, we still add cases. For example, over the last couple of days, we've been having 10, 12 cases. I know yesterday was a bit of a jump. We added some accumulative aquasastic cases over the last couple of days as well. If we look at our change, we've added 4 in Cornwall, 3 in SDNG, and 3 in Prescott-Russell, which brings us to a total of 10. And then if we look at our rolling average, we're really sitting right at the orange-yellow line. Cornwall is actually still in the orange zone. And again, we have not had a meeting with the Chief Medical Officer of Health. We have had no indication of changing, but again, I'd be comfortable staying in orange for another week. And looking forward to, like I said, looking at next week and ensuring that this trend continues in the way that it has now. The other thing that I just wanted to talk to you about as well is the fact that we do have those variants of concern. As a threat, the percentage of variants of concern actually increases now. It's up to 16, 17% when they do all the tests that are positive and they put it through a screen. And I'd just like to share with you that we have 2 possible variants of concern in the Eastern Ontario Health Unit area. We're investigating those, and we will be issuing a press release tomorrow once we get more information on that. But again, I'm not surprised. We've always been worried about it, and again, this is another reason for us to be extra cautious moving forward in that regard. In terms of other issues, again, our outbreaks really started, leveling off. We have 8 outbreaks at the present time. We have 5 hospitalized individuals and 1 in the ICU at this point. And again, numbers are much lower than they were in the past in that regard. And so our outbreaks are still, like I said, we still have a few of them. The Woodland Villa still has 49 out of the 49 positive cases in residents. 11 are active and 2 are hospitalized, actually. 18 staff were positive, 8 are active, 10 resolved, and we've had a total of 6 deaths there. Riverview Manor seems to be stabilizing as well. Again, it's a matter of time waiting for results that we did on the 23rd. The other homes, like I said, or retirement homes, all of them that are left now have no residents. They only have some active staff that tested positive, and Manoir Carillon is declared over in terms of an outbreak. In terms of schools, again, we're looking at since school started, 1, 2, 3, 5, 6, 7, 9 cases in 7 schools, with 1 outbreak at the Glengarry District's high school. So these are low numbers. And so we're just continuing to watch that as we move forward. I want to switch over now to vaccines, and we'll continue with our vaccination program. We received our dosages this week, and we're continuing with the rollout. We are setting up clinics for long-term care staff and essential visitors, as well as retirement home. We're continuing to do our tour of all of the retirement homes and long-term care. So we should be finishing at least the first dose, if not already, for the retirement homes and long-term care. And we're actually going the second dose. We're actually continuing now with our healthcare providers, and we will be very imminently going on the 80-year-olds and above. I will be just getting confirmation of the numbers of the vaccine that we have, and we will be releasing more details, but we want to do that imminently over the next week or so, that we'll be ready for the 80-year-olds. I know that the general had brought out some, longer timelines. We had a meeting with the general and, in fact, the premier today at 2:30, and it seems that those are very those are very conservative estimates based on 2 vaccines, and we will be getting more vaccines. So I think the timelines will be a bit more, like I said, more into March, April, we'll start expanding even more, getting more vaccines and so on. So we'll be moving forward with that, reacting. But at the same time, we were told we need to continue and finish the long-term care, finish the 80-year-olds as well, finish home care patients as well, and healthcare providers. Then we'll go into the next swath. So the more vaccine comes, the quicker it comes, the more we'll be moving on to other phases of the rollout. And again, we will be updating our website. We'll be updating our website of the number of doses we're giving and so on, what we've done. And again, using multiple media and other strategies, communication strategies to communicate with the target audiences. And again, the next one in terms of the public will be the 80 plus age group, and stay tuned for that. We are ready to go. Just a matter of finalizing a few things and have clinics all over the Centre Health area. Bonjour tout le monde. Je vais commencer avec les chiffres ontariens. Au niveau d'Ontario, on a augmenté par 1138 cas. Donc, ceci est un chiffre stable, à peu près 1100 à peu près depuis à peu près une semaine. Toujours, la plupart des cas sont à Toronto, autour de Toronto. Ottawa avait 64 et dans notre région, on pourrait dire que la situation est pas mal stable. En tout cas, je vais juste le trouver ici, voilà. Donc, en total, nous avons 108 cas actifs, donc 5 sont hospitalisés avec une patiente aux soins intensifs. Nous avons 8 flambées. En effet, c'est un chiffre beaucoup moins qu'on avait il y a quelques semaines. Et on peut voir que nous avons ajouté 10 cas depuis le jour précédent, 4 à Cornwall, 3 à SDNG, 3 à Prescott-Russell. Donc, au niveau de la moyenne mobile, on voit que toujours vraiment à la limite entre orange et jaune. Cornwall est toujours dans zone orange. Je pense qu'on va rester à orange pour une autre semaine, mais on va avoir une annonce d'ici demain du gouvernement pour voir. Mais jusqu'au moment, on n'a pas eu un appel du ministre pour nous dire qu'on serait changé demain, mais on va attendre pour demain. À mon avis, on devrait rester à l'orange pour une autre semaine au moins, surtout avec les menaces que nous avons avec le variant du virus qui sont une menace à travers l'Ontario, et plus en plus, on voit un pourcentage important plus élevé, donc on devrait faire plus attention. Et aussi, nous avons reçu aussi qu'on a 2 cas suspects de variantes dans notre région. Évidemment, on est en train de faire une investigation. Demain, on va avoir une press release demain avec plus de détails. Mais ceci ne me surprend pas. Je m'attendais qu'on aurait ça dans notre région. On a déjà en Ottawa, on a déjà pas mal à travers l'Ontario. Je pense qu'on est rendu en total plus que 400. Et le pourcentage des tests qui se passent un dépistage pour la variante augmente de façon quotidienne. Ça avait commencé au début de février à un chiffre d'à peu près 1%. Là, c'est rendu à peu près 17%. Et puis, vous pouvez le voir à chaque jour. Maintenant, on a des rapports au bureau au Public Health Ontario. C'est les chiffres épidémiologiques. À chaque jour, on pourrait voir la progression. Donc, ça, c'est une menace pour nous. Donc, on devrait continuer avec ce sens. Toutes les précautions devraient être prises, malgré que nos chiffres sont stables, mais on a toujours la menace des variantes. Au niveau des flambées que nous avons actuellement, il y a juste, en effet, 2 avec les résidents qui étaient positifs. Celui à Woodland, parmi les 49 résidents qui étaient positifs, on a 11 encore qui sont actifs et 2 hospitalisés. Parmi les 18 employés, 8 sont encore actifs. On fait toujours des tests et la surveillance de routine. Riverview Manor, c'est la même chose, il n'y a pas de changement. Et les autres flambées que nous avons, aucun résident n'a été positif, c'est plutôt les employés. Et Manoir-Carillon, l'occlusion déclarée fermée hier. Au niveau des écoles, je peux vous dire qu'on a peu de cas dans nos écoles. On a, je l'ai compté tantôt, 9 cas dans cette école et une occlusion. Donc, on a plus de cas dans nos écoles. Là, je vais passer avec des nouvelles de vaccins. En effet, nous continuons à vacciner les maisons à longue durée, les maisons de retraite. En effet, on devrait être presque fini avec toutes les vaccinations aux maisons de retraite. En effet, les maisons de longue durée étaient finies à peu près, je veux dire, 2-3 semaines. Donc, on est en train de faire le deuxième tour au niveau de la deuxième dose pour les résidents. Nous avons reçu les doses cette semaine et nous allons recevoir la semaine prochaine. On a toujours maintenant de doses augmentant. Apparemment, selon le général Hillier et le premier ministre Ford aujourd'hui, on devrait recevoir pas mal beaucoup plus en mi-mars. Donc, on est en train de continuer avec le phase 1 qui inclut, en effet, bien sûr, de finir la vaccination de tous les résidents, tous les employés et tous les visiteurs au niveau des maisons des retraites et des maisons de longue durée, des foyers de longue durée. Aussi des personnes qui reçoivent les soins à la domicile, à la maison, chroniques, et aussi les Autochtones en Cosasni, ça c'est à part qu'on le fait. Et de continuer avec les travailleurs de la santé en première ligne initialement et avec des autres priorités dorénavant. Importante, la semaine prochaine, on va commencer avec les vaccins pour les personnes âgées plus que 80 ans. En effet, nous sommes en train de tout préparer et on va avoir des annonces bientôt pour qu'on puisse donner les dates, les places, comment faire les rendez-vous, etc. pour cette population vulnérable aussi. Donc, j'ai hâte qu'on fasse ça. Il s'agit de juste confirmer qu'on reçoit assez de vaccins la semaine prochaine pour qu'on pourrait aller d'avance avec ça. Donc, qu'est-ce que nous allons faire? Aussitôt que nous avons on va mettre nos sites web, il va y avoir des mises à jour au niveau de vaccins, et il va y avoir des mises à jour au niveau des différents types de populations, définitions, etc. Aussitôt qu'il sort du ministère, on va le mettre à jour pour partager avec tout le monde. Et en effet, on a hâte à le faire. Vraiment, on a hâte à le faire parce que vraiment, on voit que déjà, on a sauvé des vies en faisant les maisons de longue durée et les maisons de retraite. So I'm going to look at my questions right now. I've got one about les 23, donc le droit me demande 23 cas provenant du région de la Cosasni. Oui, on avait 23 ensemble parce qu'il faisait quelques jours qu'on n'avait pas le rapport du Cosasni. Il s'agit des contacts de proches, ce n'est pas des éclosions à Cosasni. Nelson asks, have you considered St. Lawrence Park Commission and Upper Canada Village parking lots? Those are something that we're looking at. We're looking at drive-in or drive-through facilities, and those are good ideas. We haven't approached them yet, I think, formally, but that's something in the back of our minds, Nelson. That's it for now. I'm going to take some questions from the media.
Thank you, Dr. Paul. Merci. Our first question comes from Philip Blanchard, Morrisburg Leader. Please go ahead.
Hi, Dr. Paul.
Hi, Philip.
So I've got one bigger question, two small ones. So the big question is, PSWs working in long-term care homes are screened and tested regularly for COVID-19. PSWs who work in home-based care companies who don't have that same testing regimen, many aren't even tested regularly for COVID-19, even though they provide the same services in private homes, and often are in multiple client homes in a day. Why is there that difference, and do you think that should be changed?
I don't know why the difference is, but I'm going to look into why it's happening. I will speak with Lynn and get some more information on that. That is, you're right. You're 100% right. There should not be a double standard there.
Okay, and my small questions.
I'm actually meeting the Lynn tomorrow morning, so I will ask that.
So my two quick questions are, variants of concerns, when we do happen to start getting them, will you be separating those out in the statistics reporting?
Yes, we will. We haven't even thought of that. I know that provincially they will be separated, and we will put them in. I don't know how we'll add it, put an asterisk or something, but we will, yes.
And can you provide an update for numbers on the Woodland Villa in Long Sault?
Yeah, I just did before, but I'll do it again. Hold on. So Woodland Villa has had a total of 49 positive residents, 11 of which are active at this point. 2 are hospitalized. They've had 6 deaths. 18 were positive staff, among which 8 are still active.
Okay, great. Thank you very much.
No problem.
Next questions come from Thomas Stockton, TVC 22. With Ottawa first responders receiving their first doses, when are local paramedics, firefighters, etc., set to receive theirs?
Okay. First responders are receiving already in our area. Our paramedics are receiving, they're already getting it. If a first responder is a fireman or police, then they will be considered first responders. Otherwise, police and fire, who are not medical responders, will be in the next wave of essential workers.
And will the 80-year-old plus group still start receiving their vaccines locally from the 1st of March, or has that date been pushed back?
No, it'll be next week at one point, the week of the 1st of March. I'm actually having a meeting to finalize it this afternoon.
Thank you. Next question, Nelson Zandbergen, Nation Valley News. Please go ahead.
Oh, hi, Doctor.
Hi, Nelson.
The Chrysler residence, where does that fit into your plans? I heard something that maybe they haven't been approached yet about, because they have some elderly people there.
Is that a retirement home?
I believe so.
I think we've done them. I mean, I don't know I don't have the list with me.
Okay.
If it's a retirement home, we've done it.
Okay. I'd have to double check into what their status.
If it's a group home, it's the next. If it's a group home, it's the next phase. They have others that are called congregate high risk.
Right.
That's the next one. So, but I thought it was a retirement home. I wasn't sure.
Okay. Much has been made of the 34 or 35 plans that we have in Ontario for the rollout of the vaccine as compared to other provinces that have like one provincial plan.
Yeah.
So that said, that means, I mean, the media can sort of judge each plan, 34 or 35 plans in Ontario against each other now. What are you going to do to make sure that your plan is the most effective of the 34 or 35 plans in Ontario?
Well, first of all, it's not a competition.
Okay.
It's not a competition. We will do, and I've gone on provincial radio. I've gone on radio, I've gone on TV, and I've said that I think the approach of having 34 different health units do it their way, I think is the right one. I believe that you know, if it was left to Toronto to decide the exact direction and exact identification or communication to all vulnerable populations, to how we overcome barriers, physical barriers, geographic barriers, and all that, that it would have been very difficult. So I think the beauty about the 34 different health units is that it allows us to really hone in on our very familiar territory. We know the municipal partners, we know the police, we know everybody, we know schools, we know community agencies, we know physicians, primary care practitioners, pharmacists, we know them all. We know where our pockets of vulnerable populations are. We know the demographics of the population, and we know how to reach them. And I think it's more efficiently done that way, albeit it may be different. Yes, I was on Toronto radio at noon, and they were comparing us with Toronto, and it was different because we're rural with 200,000 people. There you go, a couple of million people, you know, in shutdown zone already still. So it's a different context. So I do believe that we have everything in place. We've done it before. We've done massive immunization clinics before. We distribute vaccine in our area for decades traditionally. So I do believe that the 34 health unit approach is the correct one because of the fact that it is the most logical one. I mean, if you had if you had to do, to build a building, you sort of get people that are experts in building buildings, like that's what we've done.
Mm-hmm. And just one little follow-up. So yeah. you won't care if you rank 34th. I know it's not a competition.
I really don't care. I just want to I want to get people done. It's not a competition.
Okay. Thank you, Doctor.
You're welcome.
Dr. Paul, we have several requests in the chat box to please address the situation at St. Albert Cheese Co-op, et en français aussi plusieurs demandent d'adresser la situation à la fromagerie Saint-Albert.
We're investigating that. On est en train d'investiguer, puis on va avoir plus de nouvelles demain. We're aware of the situation, and we're investigating that right now, and we will have a press release tomorrow.
Thank you. Merci. Next question, Denis Babin, Radio-Canada. C'est à vous?
Oui, bonjour, Dr Paul. Évidemment, c'était pour parler de la situation à la fromagerie Saint-Albert. On nous a confirmé plus tôt cet après-midi qu'il y avait 3 cas positifs de confirmés chez les travailleurs et que 2 de ces cas-là étaient possiblement reliés aux nouveaux variants détectés en Ontario. Qu'est-ce qui vous empêche à l'heure actuelle de pouvoir justement confirmer que c'est bel et bien le cas?
C'est le cas, je peux confirmer que c'est le cas, mais je ne peux pas confirmer tous les autres détails.
OK, d'accord.
On est en train de faire une investigation. On était au courant, ça fait quelques jours, et on est en train de faire une bonne investigation pour voir toutes les données pour qu'on puisse avoir plus de détails demain.
Donc, vous aviez l'unité mobile du Bureau de santé de l'Est de l'Ontario qui était là aujourd'hui pour tester les employés, c'est bien ça?
Ça fait partie de notre investigation, oui.
Parfait. Et donc, vous n'êtes pas en mesure de confirmer pour l'instant que les nouveaux variants sont reliés à ces cas-là,
On est en train de confirmer.
Okay.
On a une suspicion, mais on est en train de le confirmer. Parce qu'en effet, avec tous les variantes, on a un dépistage qui est positif, donc on attend la confirmation.
Merci beaucoup.
Pas de problème.
Do those joining by phone have questions? Press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Seems as though those are all the questions for today, Dr. Paul.
Thank you very much. Bye-bye.